Well, there's a new project just announced today at the U of M to provide the country with another source of vaccine information. Sammy Salino breaks down how it will work.
With mixed messages of vaccinations at the federal level, a University of Minnesota initiative hopes to clear the air.
Every day, we seem to see new and disturbing developments occur around our vaccine enterprise.
Dr. Michael Osterholm heads the U Center for Infectious Disease Research and Policy. They just announced the Vaccine Integrity Project, which would allow a team of health experts to start its own vaccination evaluations and guidelines.
That would be our first, second, and third choice, is to have our federal government do its job and to make that happen. But if that doesn't happen, there has to be alternative voices out here that are based on the science.
Health Secretary Robert F. Kennedy Jr.'s track record of vaccination skepticism has been criticized by Democrats and health professionals.
Senator, I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS Secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
And recently, experts have called his characterization of autism as a preventable disease as unfactual.
Let me be really clear at this point that we all recognize that the vaccine enterprise is at some risk right now.
Dr. Osterholm says that in the event federal health agencies gives guidance that isn't backed by science, the group can step in.
They deserve a factual approach, and we'll just continue to pursue that.
This group says it received a no-ties grant from Alumbra, and for now it will start with an 8-person steering committee that will help solidify the group's goals. In a statement today, a Health and Human Services spokesperson responded, calling the project, quote, led by establishment leaders. It's less about integrity and more about salvaging the credibility of a public health bureaucracy that failed millions during the COVID-19 pandemic.